There were many new trials on cholesterol from the American Heart Association scientific sessions meeting this weekend.
So to discuss what you need to know in the latest about cholesterol treatment is our medical expert, Dr. Pyle Coley. Dr. Coley, good morning.
What an exciting weekend of science it was.
Well, we were just talking about, our own medical history, and I was telling you from family, I have higher cholesterol just from my genetics.
Yes, and this is a lot of people think that, oh, well, it's my weight or it's the way that I'm eating that determines my cholesterol, but actually 75% of your cholesterol is genetically determined, and only about 25% is determined by diet. Now, the two pathways talk to each other, so what your liver makes versus what you eat. You eat a piece of steak, it actually does turn your liver on to make more cholesterol, so the pathways are interrelated, but I have patients in my office every single day that say, Dr. Coley, I'll change my diet, I'll lose weight, and I say to them that'll only modify about 10 to 15% of your cholesterol, even with the best lifestyle changes.
Yeah, good to know.
So that means it's all our genetics, which means we need to start thinking about it early in life.
Okay, well, we got to all think about this because this is connected to obviously heart disease and risk for other factors.
Cholesterol is in fact the biggest modifiable risk factor for heart disease. So this is what drives me bananas. Many of us say, okay, every 40 seconds an American has a heart attack. Well, there's nothing we can do about it, right? Wrong. There's plenty we can do about it. And cholesterol is one of those biggest target signs. And we have so many Americans walking around with elevated cholesterol. In fact, we start putting down cholesterol deposits in our arteries in our 20s and 30s. And then it really starts to kind of misbehave later in life in our 50s and 60s and 70s. And what happens is the cholesterol gets stuck to the wall of the arteries. And then that cholesterol getting stuck causes our immune system to react. It causes inflammation, which then makes the artery more sticky. More cholesterol gets stuck. Now you've got blockages that are ready to pop and cause a heart attack or cause a stroke in your 50s, 60s, and 70s.
So Dr. Coley, let's talk about what is genetics and then what is what we eat.
Yes. So most of it is genetics, which is why you cannot make the excuse that, you know what, like, oh, I'm eating great, I'm doing well. I have high cholesterol and I eat great and I'm not overweight, and it all has to do with genetics. So the way we think about it in cardiology is we say, okay, we can't modify your genetics and we can't modify your age. We can't modify your family history or your ethnicity. But in order to counteract the risk conferred by those factors, we drive down that cholesterol, which means that most Americans over the age of 65, just because of their age, even without having high cholesterol, should be on a cholesterol-lowering medication to counteract the risk conferred by that age.
How do we know who should be on cholesterol treatment of some kind?
So I have never had a patient walk into my office and say, Dr. Coley, my cholesterol hurts. Because cholesterol does not cause symptoms until it causes that heart attack or stroke. So we have to look at that cholesterol, which means once a year you have to get that cholesterol checked. I would start checking people in their 20s. People often wait till later. In fact, we even check kids for genetic problems with cholesterol one time when they're kids to make sure they don't have it. And then based on your risk category, we decide whether or not to treat you. Most Americans need to have their LDL, and the way to remember, LDL is the bad cholesterol. You want to keep that low. HDL is the good cholesterol. You want to keep that high. You want your LDL less than 100 for most average risk Americans. If you have diabetes or other risk factors, less than 70. If you have had heart disease, it's less than 55. Wow. So stop looking at that total number, which I have people come in all the time and say, this is my total cholesterol. We don't care about that. Yeah. We care about the bad stuff, which is the LDL and the non-HDL cholesterol.
So we have just a couple of seconds left, but one of the trials from the American Heart meeting looked at giving an injection medication to people on statins who had never had a heart attack or a stroke. And for full disclosure, you've done research on this, you've consulted on drugs. What did all of that show?
Oh, it's so interesting. It's changed our thinking completely, because we used to wait for that heart attack and stroke and then say, okay, now you've had a heart attack, now you need really aggressive cholesterol lowering. Now we're saying people without heart attacks and strokes, just with high risk factors like diabetes, that's high risk, drive their cholesterol way down. In fact, in the study, they got it down into the 40s, and you'll reduce that first risk of heart attack by 36%. Another study looked at reducing risk of stroke by 25 to 27%. So I'm not endorsing any specific drug. I think any drug that lowers cholesterol would have this kind of outcome. But the idea here really becomes earlier the better. Start thinking about lowering your cholesterol. And our mantra is lower, faster, for longer, because it's a poison inside your artery.
Absolutely. Well, we're getting into the holidays, so people thinking about gift giving. I always say the best gift you can give yourself and your family is healthy and to be around.
Yeah, so check those numbers and talk to your cardiologist or your primary care doctor.
I love it. Dr. Coley, thank you so much. We appreciate it.